world, anxiety, depression, and addiction are affecting more people than ever. Think of someone you know, a friend, a colleague, a family member who's faced a mental health challenge. Most of us can name at least one. Today, we are bringing together experts from China, the US, and Europe to talk about how research, policy, innovation, and cooperation can support people like them all over the world. And joining me are Mark Potenza, Stephen Southwick Professor of Psychiatry, Neuroscience, and Child Study at Yale School of Medicine, Nestor Zerman, President of World Association on Dual Disorders. He's also MD at the Institute of Psychiatry and Mental Health at the University Hospital Gregorio Marañón. Zhao Min, President of the Shanghai Mental Health Center, Director of the National Center for Mental Disorders in China. And she's also a member of the World Health Organization's Strategic and Technical Advisory Group on Mental Health, Brain Health, and Substance Use. And Yue Weihua, President of National Clinical Research Center for Mental Disorders at Peking University 6 Hospital. A very warm welcome to all of you. Now, I want to begin by sharing with you a group of a staggering number. The WHO says nearly 1 billion people worldwide are living with a mental disorder. So, doctors, from your experiences, what's driving such widespread mental health challenges today? May I start with Professor Potenza?
Yes, thank you for having me. The rise in mental health concerns may be attributable to a number of factors, but we see this globally, including with respect to youth, developing youth like adolescents. One factor that has been proposed is the ways in which children and developing individuals are exposed to the internet. How the internet is playing a significant role in people's lives that may lead to social comparisons where people feel less secure about themselves and may experience more anxiety and depression is one possible reason.
I want to get your thoughts on this, Dr. Zerman. What's behind such prevalence of mental health issues?
Okay. Again, thank you for having me. It's a pleasure to be here. The prevalence of mental health disorders around the world probably is the same, but it's marked by different factors that are, first of all, genetic and neurobiological factors, and of course, environmental factors. The last factor, environmental factor, is changing, and every place and every setting is changing, and they are giving different expression of different mental disorders. Regarding neurobiological disorders, I'll be sure, it's the same because there are different people, different ethnicities, different genetic background. The mental disorders are presenting and expressed in different ways in different parts of the world.
Of course, and Dr. Zhao, can I get your thoughts on this? What is driving the increasing trend of mental health issues worldwide?
As the two speakers have said, such mental health growing in the world has a lot of factors. Usually, we talk a lot about biological factors, but of course, with the addition of mental factors and social factors, there might be a new triggering of some commonplace disorders. For example, the environmental changes, the financial situation, or burden, and so on. Those factors might all lead to the mental health challenges.
那么也想请岳医生谈一谈您的看法。全世界范围内大概有10亿人患有不同程度和不同种类的这种精神性障碍的疾病。您觉得它的这个高发的原因是什么？还有您看到了哪一些这种新的趋势？
这个生物学的方面，刚才前面的3位教授都。
The three speakers touched upon the biological factors, which are quite stable, which is also the starting point of such diseases. But as to the environmental issues, for example, fierce competition, environmental pollution, the level of the society, communication and interpersonal skills, those might also be the factors.
Now, of course, Professor Potenza, can I ask you about the emerging trends that you observed from your clinical practices and your years of research in the field?
Yes, we've seen changes recently in terms of particularly young individuals, adolescents, emerging adults, young adults experiencing more mental health concerns. Some of these are in the affective domains like depression and anxiety, but we also see changes within addictive domains, particularly how people engage in what are called behavioral addictions. There's been increased media coverage, increased advertising. So we do think that these environmental factors that may interact with biological factors are concerning in multiple areas.
Yeah, well, many parents and educators worry about gaming and internet use for young people, adolescents, and your research examines both substance and behavioral addictions. What actually happens in a young person's brain, especially in areas that control impulses and rewards, when gaming turns into addiction?
I think this is an important area to understand better. And the existing data support some propositions that people have made. So B.J. Casey and colleagues have suggested that brain regions involved in motivational drive, like subcortical brain regions that are involved in urges or motivations to engage in immediately pleasurable behaviors, that these brain systems may mature more rapidly than brain regions that are involved in controlling these drives and urges. And this leads to adolescence being a time of increased risk-taking and engagement in potentially addictive behaviors. We also know that there are some brain factors that have been associated, including in adolescents and young adults, with the emergence of gaming disorder or the presence of gaming disorder. And some of these brain changes suggest that people who are at greater risk or experiencing behavioral addictions like gaming disorder, internet gaming disorder, may show less of a brain response to non-addictive rewards. So finding a balance between engaging in other activities and having those generate pleasure, perhaps activities that are more adaptive and lead to longer-term success, may be important for developing youth.
How are these behaviors linked to mood problems like depression and anxiety? Do they trigger each other?
Another great question. And as the other speakers have mentioned, we've seen rapid changes in the environment, particularly with respect to digital technology use over the last decade or two. That being said, we are understanding that the co-occurrence of affective concerns, depression and anxiety, and problematic usage of the internet in various formats, that this seems to be an important co-occurrence. There are elevated odds of affective concerns in people with different types of problematic usage of the internet, including gaming disorder. And these motivations to engage in the behavior due to coping with negative affective states, that is one of the factors that is strongly linked to problems with forms of internet use.
All right, now, Dr. Zerman, you lead the World Association on Dual Disorders. And for people who are not familiar with the term, what exactly are dual disorders and why are they such a growing public health issue?
Yes, thank you for the question. Dual disorder is the term that we are designing people who suffer from addiction and other mental disorders. The order is important because addictions are mental disorders. This fact is not well recognized. and not just only in the international classification of mental disorders, but also for the clinicians and people who are working and coping with people who suffer from addiction and other mental disorders. This is not a unique term around the world. There are diverse terms referring to this clinical condition. The most common are comorbidity, concurrent disorders, dual diagnosis. But from the WDD, the World Association on Dual Disorder, we agreed and to reach a scientific consensus and use the term dual disorders, addiction and other mental disorders.
Right. Now, what are some of the most common pairs of dual disorders that you see in clinical practice? What makes diagnosis and treatment for these patients particularly challenging?
Yes, it's depending of the environment of different countries, depending of the different substances that are legal in different countries. Recently, we have been in some Western countries, in the US also, different drugs are now legal. For example, cannabis is now legal in a lot of US states, and countries such as Canada, South Africa, Uruguay, and other countries probably are coming. This is a decision of the society that are decided that cannabis will be legal. This is a new situation that is a new challenge for all of us, not just for clinicians. It's just a challenge for policymakers and different people who need to treat with this new situation. But answer your question, the different drugs are more legal in different countries. For example, alcohol is not allowed in Muslim countries in comparison with, for example, with cannabis. But in these ways, is in every country, in every world region, the prevalence is different. In Western countries, the most common drug or substance is first is alcohol, because it's very common in our culture to use alcohol. In the second, drug is also legal, is tobacco. Both of substances are the most common addictive disorder that are presenting together with all other different mental health conditions.
Now, I believe our panelists would all agree that cases vary from region to region because, as you mentioned, some countries they have different religious background, so the people there would have a different kind of prevalence of mental health issues. And also, some countries have separate systems for mental health and addiction treatment. How does this perhaps siloed approach affect patients, or what kind of integrated treatment model do you support?
This is one very important thing, because in our tradition, addictive disorder was separate for other mental disorders. This is supported probably in old vision that is a behavioral problem or moral problem. But in fact, we need to differentiate between use substances or taking substances and addictive disorder. People who suffer addictive disorder, the main characteristic, according to scientific research, also animal studies, is seeking substances. Definitive behavior that characterize people who suffer an addictive disorder. We are promoting the treatment of all mental disorders, including, of course, addictive disorder, because all of them are brain disorders. And these brain disorders are expressing with or shows in nature with different phenotype, with different symptoms. And we need to treat all of them together. Until now, the existence of separate services to treat one disorder or another disorder is affecting the result, because in this way the results will be very poor. People are losing in this. Meanwhile, they are finding the right door. The right door, because we are using a term in our field that is the wrong door syndrome. People who are need to find what is the right door, because they are knocking. One door is just for addictive disorder, and another door is for mental disorder. This is a big mistake. We need to promote an integrated treatment for our patients who suffer addiction and other mental disorders.
Mm-hmm. Well, thank you so much for shedding light on the prevalence of mental health issues worldwide. And now we'd like to shift our focus a little bit to China. So let me ask Dr. Zhao the following question. Here in China, depression cases rose more than 50% from 1990 to 2021. Anxiety cases rose by more than 30% over the same period. From what you see in your clinics, which groups are experiencing the fastest growth in mental health needs? Was it young people, older adults, students, or perhaps working professionals?
To answer your question, we need to firstly look at the data. And I've gone through the data. For example, based on age groups. And there are some characteristics. For example, females have a higher ratio compared to males. And based on my personal clinical experience from my institution, one stark feature is about between 3 different groups of the elderly, the middle-aged, and the young. For example, for the adolescents and the young children, when they seek intervention in our clinics, in addition to the mood control issue, there are some other issues like behavioral problems, like gaming, or some self-infliction. And also they suffer from the physical discomforts, and they don't want to study. Another big group is about the middle-aged working professional. They mainly suffer from anxiety. So the number of the middle-aged stand in between. Particularly, they are under a huge burden of taking care of the old and the young. And also they have to be confronted with the uncertainties in their career. That's why they suffer mainly from anxiety. Another major group of population is the elderly. They have maybe just retired and they were left alone at home. They felt lonely and their family structure may have just changed and they're aging after all. So the elderly population seem to suffer from sleeping issues and some physical changes and depression. It's quite common. Another feature is about the female group. They also have a bigger emotional demand compared to men. Be it depression or anxiety, the prevalence ratio of females seems to be higher than males. That is highly relevant with the biological features of females, so they were more susceptible to the genetic factors. For example, the neurotransmitters, or whether they are during the pregnancy period. And the numbers are increasing.
赵医生刚才给我们分享了一些最新的趋势，所以岳院我想请您谈一谈就是我们知道这个北医六院呢，作为中国精神卫生领域的一个领军的机构，有哪些这种比较前沿的技术，或者说一些核心的理念机制，取得了比较重要的突破，或者说让您非常鼓舞的这种新的进展。
We are a national level institution directly managed by National Health Commission. We are a professional hospital, and we are also the research center of mental health issues. We are also the project management office relevant to the projects of mental health. So we may have to undertake a lot of technological work. And we hope to be people-oriented, so we observe humanity. And as to the research areas, we took the lead in completing the epidemiological survey with a lot of data. For example, the prevalence ratio of depression is about 6.8 and anxiety 7.2 based on the third round of our survey. Now we are taking the lead of the fourth round of the survey, and every March we will have some updates about epidemiology in China. So that's the social work we have done. As to biological factors, academician Lu has taken the lead to study about the substance use disorder, addiction, and the neural intervention about sleep disorders in order to improve the mood of the patients. So these are very influential studies we have made. We also have our own research teams working on the interaction between genetic factors and environmental factors, studying the treatment plans, the customized mechanisms, and we also took the lead in studying these 1.1 class new drugs. So we have some capabilities.
So we understand that you've done a lot of in-depth research on the genetic susceptibility of mental disorders. Would you explain to us in plain languages what this means to discover these genes for ordinary people?
For
some common diseases, for example, among the children, autism has a genetic proportion of 90%, and the environment factor accounts for another 10%. For schizophrenia, 80% may be genetic factors, and environmental factor accounts for 20%. For depression and anxiety, it's about 30% to 40% of genetic factors and also 60 to 70% of environmental factors. That is to say, for the depression patients, we have a bigger room of resorting to psychological help and social support to improve their mood. For the autism, we need to go to the biological factors to intervene. We need to educate people more about the different factors. So different mental disorders may have different intervention mechanisms. Exactly. And as we learned, your team has studied the brain electrical analysis. How can that study better help doctors to have precise diagnosis and treatment? For the brain electrical studies, the biggest strength and benefit of it is non-invasive characteristic, and it's very convenient. Through the big data modeling and analysis, we could customize the treatment therapies, for example, based on the safety of the intervention that could better reflect the changes of their mood. That would be very helpful of assisting our clinical therapies. And it facilitates our objective diagnosis and treatment. And Madam Zhao, based on your observation, now the Chinese public may have some boost of their awareness of mental health. Is that true? That's a very good question indeed. As to the public awareness of mental health, it is critically important for mental health. In recent years, the psychiatrists in China has paid more attention to not just the rehabilitation and treatment and diagnosis of mental illnesses. Instead, they turn their sights to the awareness building among the public. So in general, the public has higher awareness of mental health, and their needs in that regard are showing new trends. For example, they are more active, more responsive to the clinicians. They may not necessarily suffer from the disorder issues. They may have some very healthy mental needs. For example, how to keep a good family relationship, how to have some interpersonal skills, and how to deal with their psychological burden. So we found out that with better knowledge about mental health, their mental needs are on the rise. And it is more diversified in their needs. In general, we found that the work of mental health sets sights on not only the illnesses, but also how to be the master of your own health.
Compared with other countries, how do the situations and conditions here in China are similar, or in what ways are they different from the cases in other countries?
For similarities, the professionals and the governments, they pay equal attention to mental health. Another similarity is we face similar challenges. For one thing, the public has boosted their awareness of mental health. But still, stigma and discrimination in the society are still there. How can we integrate those patients into the society to establish a friendly society for those patients that is going to help those patients to recover? And that's our common challenge. As to the unique differences, internationally, they may go to the grassroots level clinics to do the screening, education, and training. In China, we are still putting more energy into the professional studies.
我还想问您，就是在这个
Another question to you.
提到了很多新的趋势和变
We've
化
talked a lot
那么
some
上
new
海市精
trends
神卫
and
生中心
changes.
推出了哪些
For
创新
the
式的服务
Shanghai Center, what are the innovative services?
So my question is, how is the Shanghai Mental Health Center responding to these new trends, as you mentioned? Could you perhaps share an innovative service model that you are piloting?
对，针对我们现在公众心理健康需求大，但是
With the rising demand of mental health,
其实是难以满足
the professional institutions'
我们大众
capacity of serving the public is in shortage.
那同样我们跟岳院长一样，
Similarly, like Madame Yue has mentioned, we're the National Mental Illness Research Center. One of our functionalities is to take the lead and exemplify the mental health services in China.
在这个方面呢，
So, accordingly,
理念就是要
our philosophy is
精神卫生的工作从
to facilitate mental health work, to transform from paying attention to only diagnosis and treatment of mental illnesses to facilitating mental health among the public. We endeavor to establish a system with full participation of the society and a service system that endeavors to serve the whole life
接
cycle,
下来呢，我们
the whole chain. So we're like the national team for the benefit of the public's health. In the future, we are going to come up with some new technologies to serve the public health and to target at some commonplace mental illnesses. For example, we
普通人群的科普，
must pay attention to facilitating the knowledge of mental health among the public
有助于早期发现、早期干预
in order to pave the way for early discovery and early intervention
开发一些适宜
with our
技术
toolkits.
能够在
And we're going to develop some adaptive technologies to benefit a larger population.
注重的一方面。
Those will be the priorities of our work. In addition, the mental health work involves multidisciplinary cooperation. We have to integrate resources in the hope that by working together, the family, the schools, and the whole society, as well as the medical institutions like hospitals, could work together to facilitate mental health in our service system. And as to the
专科服务能力，
hospitals, we must improve our professionalism.
比如说我们自己
For example, in recent years,
这个近视障碍，我们成立了
we have established a clinical center for the treatment of myopia.
治疗。
The patients could easily access the services. And as to innovating the services, we are also employing some new technologies, for example, BCI and neurotransmission. Some are invasive, some are non-invasive. So those technologies are applied in the mental health sector, especially to improve our capacity of treating with those difficult and major diseases. So we also combine traditional Chinese medicine with the Western medicine. And in general, we are patient-centered. The final priority is about talent cultivation. Now we are in short supply of our services. So against that backdrop, we have to cultivate multidisciplinary talents, especially rehabilitation centers, doctors, and the trainers. We also have some projects. The 4 centers work together to initiate a psychological training session for the whole nation.
Thank you. We understand that the use of technology has certainly been a major part of mental health innovation globally. So I'd like to hear from our guests, Dr. Serman. What role do you see for AI in diagnosing and treating addictions? Could it help identify at-risk individuals earlier, or perhaps provide personalized support? And at the same time, what do you think are the limitations with the use of technologies?
Okay, this is a very important question. As you say, it's very important to identify people, adolescents and children with high risk to suffer a mental disorder. When I say mental disorder, I include, of course, addictions or addictive disorders. It's very important to go where the adolescent or children are, in the schools, in the diverse institutions, where we can find them and identify people who are at high risk. In this way, it's very important to use the new techniques, and one of them is AI. AI will be very important to know every different individuals, every different people, because we are going to a new perspective of the medicine, including psychiatry. Is that we call precision psychiatry. Precision psychiatry is going to identify different people, different persons, females or males, and different ethnicities, different personality traits, and for all of this work, we need the new technologies. The new technologies is starting with the AA and other technologies that are going to allow us to identify or more precisely who are at high risk to suffer mental disorders.
Mm-hmm. And Professor Potenza, what do you see as the most perhaps promising directions in addiction therapy or research, especially for young people? Are there any new intervention programs already in trials?
Yes, so I think this is a very important question. And I think we should be thinking about both prevention and treatment in this regard. So with respect to prevention efforts, there have been a number of approaches utilized in North America that historically, for example, have given developing youth, adolescents, knowledge, but not necessarily changed their behavior with respect to engaging in problematic concerns like substance use behaviors. An investigator, very talented investigator out of Canada, looked at a number of factors in large samples and determined that a large amount of the proportion of risk related to features like impulsivity and difficulties with delaying gratification. And she developed a prevention program that enhanced skills in emotion regulation and in delaying gratification, and has shown that these skills then help developing youth avoid concerns relating to substance use and related mental health concerns. So I think interventions that give people skills are really important in terms of the longer term success. Some of the work that we are doing on the treatment side that incorporate digital technologies are to develop, and now we're in the process of testing in a randomized clinical trial, an app that delivers cognitive behavioral therapy to individuals with gambling problems. One of the things that we and other groups have observed is that often when developing mental health apps or mHealth apps, if people download the app, they may use it once or twice and then never use it again. So engagement, continued engagement over time is a significant barrier to promoting mental health using digital technologies. And to try to overcome this, we have used focus groups, interviewing people with gambling problems, interviewing people who help people with gambling problems, and then develop characters in order to highlight how cognitive behavioral skills can be used in hopefully a dynamic and interactive and engaging way. And by doing so, we hope that this will lead to more engagement with the app. But we do have to test this, and that's what we are doing presently. And these are just some examples.
So how have you and your center been using tools like AI and big data in helping with diagnosis and treatment of patients? Are there successful stories, for example, perhaps an AI-assisted screening or diagnostic system that you could share with us?
Yes, I think that this is an important frontier, and I would argue that we are making significant steps, but we are not at the point of precision psychiatry. Other fields of medicine have advanced more rapidly. So, for example, in terms of cancer treatment, some of the cancers that led people to die within weeks to months when I was a medical student, now we don't know how long people will live because we have a better biological understanding of the cancers, and then we've developed therapeutics that can target those precisely. We're not there for mental health disorders. As we've heard from the other speakers, there are both significant environmental and genetic contributions, and oftentimes the genetic contributions come from many genes rather than one gene having a mutation, as in some forms of cancer. And I think this makes it more challenging to develop precision psychiatry approaches. Now, with big data and AI, and we don't know what the boundaries of those will be, what the power of those will be, I'm hopeful that we will make advancements in psychiatry like we have seen in other fields of medicine.
There are still uncharted water. People are still trying to explore the boundaries of tools such as AI tools, such as big data, so on and so forth. So, Dr. Zerman, what do you think are the limitations of using tools like AI in psychiatry and in your field of research?
Okay, I think my colleague, Professor Potenzas, affirmed clearly we are having more challenges in our field in psychiatry than in other field of the medicine. But we need to incorporate these new technologies, AI and big database, in order to move forward, to advance the identification of people and children and adolescents who are at high risk to suffer mental disorders. This is in order to prevent mental disorders, and we need to intervene with them very early. But the first thing is to identify them, and for this job, it's necessary to use AI and other in big database for the general population. After that is the treatment of our patients. Once we have identified them, we need to treat them. And as Professor Potenza mentioned, it's very difficult because there are not one gene as another illnesses of the medicine. There are different, a lot of genes involved in mental disorders. And there are a lot of environmental factors involved in the development of mental disorder. But there are barriers, but I think we are moving very fast in order probably in the next decades, we are having more precise tools to prevent and treat our patients.
Scientists around the world have so much to work on together in this field. And talking about that, we know that Dr. Yue here, your team has rolled out this very special voice recognition program for rapid depression screening. How exactly does it work and what kind of significance does it carry in real life clinical use?
感谢您的问题。
Thank you for the question.
像前面几位教授讲到的
As the previous speakers mentioned, AI and big data combined contribute greatly to the psychological area. There is one example clinically. Depression prevalence ratio is about 6.8%, but only 9.5% of them seek treatment. So a large majority of the depression patients may still be out there in the communities or in their career, especially the children. And now the diagnosis efficiency is very low. We have to interview them question by question. So it took us usually over half an hour to have a precise diagnosis of a possible depression. So we usually adopt the DSM-5 standard, internationally accepted. We ask the questions one by one, and we screened out those diagnosed depression cases, taking them as the labels of depression. And then we take a record of 5 minutes. In the 5 minutes, we have some casual talks, and we try to introduce some specific questions into the talk. And after the recording, we would analyze the 1.9 billion pieces of voices. And then we compare those pieces of voices with the clinical labels. In the end, with the voice collection system, the specificity is over 80%. And in that way, they may be taken as biomarkers. In addition, we have an independent sample verification process. So the model is pretty stable. That's a typical case of AI plus big data to help us screen out the depression sufferers. The reason that we chose voice is that when we are happy, our tone might be up and the frequency may change, especially for the continuous depression sufferers. The change of the tone is very obvious and conspicuous, so we can easily screen those individuals with depression. After screening, we would classify those groups. For the mild cases, we would educate them. For the moderate ones, we would have some online intervention therapies. For example, meditation, positive energy, and diary keeping. After a while, we would follow up to check on their indexes of anxiety and burden. For the severe cases, we would ask them to seek help in the medical institutions, especially the ones who are most prone to suicidal behaviors. So that's our theory of classification. And also, we must follow up them frequently. For example, 3 months' time follow-up visit. In that way, those patients in the remote areas or in areas that has less access to the resources, or those people who are unwilling to go to seek help in the professional institutions, we would follow closely on them. As we know, in our voices, there are a lot of emotions, but we never know that in our voice, there are so many signals for us to decide on their psychological states. And now we know that your team is trying to disseminate that AI voice system worldwide. In terms of international partnership, how do you think China can work with other countries? We are engaging largely with many countries. For example, genetic and environmental interaction, like imaging. We would find some potential biomarkers Those would help us to screen the depression and schizophrenia patients. And in addition to the voice collection system, we also have some online intervention measures. For example, your gaits and your facial expressions, those might be some sensitive indicators. So I do think we have big room of partnership. For the voice collection system, we've taken it to India and Singapore for some small sampled studies. And in the meantime, we are engaging with the international medical.
So, Dr. Zerman, I'd like to get your thoughts on this. Are you optimistic that this AI voice recognition system could help doctors worldwide in terms of fast screening of mental disorders?
Okay, it's very important for us to recognize that and use the new technologies. And worldwide, the AI is nowadays a very current tool for every field. And of course, it's very important in our field. As we are saying in all this forum, all the mental health conditions are based on the brain, are in the treatment, should be biological, psychological, and social treatment in this order. And AI is, I think, is very clear that it's allowed to apply to database. We are going to schools, to different places where children and adolescents are living and interact between them. We need to identify with these tools. This is the way that I think we need, because until now, psychiatry and the description of mental disorders was located in the last century, with the only phenomenological symptoms, phenomenological description of behavior or cognitions or emotions. But we need to move forward and to go to identify from more than the old way that we have until now.
Mm-hmm. Now, of course, it's clear that to tackle these global challenges, we must collaborate beyond our borders. So let's talk about international collaboration. What can make it a reality? Professor Potenza, the WHO report highlights a major shortage of funding and mental health professionals. So in what areas do you see collaboration to improve for international communities to focus to address these gaps?
I think this is a very important question. How do we best work together across different countries and jurisdictions? Some of the work that I have been doing with either the World Health Organization, the International Society of Addiction Medicine, or other organizations suggests that by working together, we can address these complex concerns that different societies face related to mental health and other psychiatric concerns like addictive disorders. I think that there are different ways in which we can work together. So with the World Health Organization, for more than a decade, a group of us have been working together on how best to define internet use behaviors as the basis of psychiatric disorders, given the changes that have occurred in the field, in society over the past several decades. How do we train people? So the World Health Organization held a meeting in Changsha in 2024 that involved groups of people from around the globe working together to discuss and then hopefully implement how we train health professionals to help people with addictive concerns. I think working together, for example, with Professor Zhao, we have worked together and collaborated on different studies, including one that Gangliang Zhang first authored that came out in Nature Mental Health, where we can work together across jurisdictions to try to address the most pressing mental health and addictive concerns that different groups face.
Sure, and now I'd like to have Dr. Zhao's input in this. 那么赵医生，我们知道这个世界卫生组织的报告显示呢，各国对心理健康的投入和专业人才依然有严重的不足。所以说，您觉得国际社会应该最优先推进哪些合作来填补这些缺口？
第一呢，就是我们要有一些我们的推动精神卫生
to encourage the balanced distribution of medical resources and try to cultivate more professionals like those working in the treatment of mental illnesses, the doctors, nurses, and those working in rehabilitation centers. WHO has its own priorities. For example, last year in Shanghai, entrusted by WHO, we staged an event about training of the professionals. The objective of that session was to train the doctors in the other divisions to have the capacity of mental health. For example, how to identify the common mental illnesses and how to diagnose and treat them. Those other divisions must be capable of working together with our psychiatrists, because right now the number of psychiatrists is still in shortage. So the other divisions in the hospitals must be able to offer such mental services. In China, mental service providers are in short supply. That's a very urgent problem. And we do hope that those counselors and treatment interventionists must be involved in such training programs. After all, that is a very important part of mental treatment in addition to medications. I think counseling is a very important means for the majority of psychological problems. So we are in need of a large number of the counselors who provide such counseling services. We must give top priority to that area.
那么，岳教授，我们知道在座的各位嘉宾和各位专家都是来自不同的地区、不同的国家，所以在国际合作方面，您觉得我们可以优先哪些选项？比如说，去更好的这种分享临床经验，还有一些诊疗的数据，如何可以推动
clinical data and experience of diagnosis and treatment? That's a very challenging question, because we have different cultural backgrounds, different social systems, and the doctors are serving different groups of population. But from a clinical perspective, I think we can have some common standards to diagnose and categorize the diseases, like Professor Jiao and other international experts work together on the newest standard compilation, SDE 11. So I think the categorization of those diseases might be the area for us to work together. We must be standardized. Standardization matters. And with the new criteria, new standards, we also need to continue to train the experts in order to improve their level of application. As to research, we need similar standards and regulations. When we come to the consensus about the standards, our knowledge about certain diseases would be on the same page. And for the majority of the time, we would put together the big data like the high-level studies, and the results of the studies would be of great reference and significance for us to translate the study results to the clinical benefits. And also we must build up our awareness of ethics in order to implement those guidelines and standards. So I think those international multi-center standards and guidelines would be very helpful for our clinical practices or scientific studies and teaching sessions. Indeed, you're right. Different countries have different situations. So in implementation, there would be some obstacles. Now let's turn to our experts.
Dr. Zimmerman, with so many cultural and policy differences, as Dr. Yue just mentioned, what are the main challenges and opportunities when sharing research and clinical best practices across borders, and how can international collaborations assist in standardizing research protocols, clinical best practices, and data sharing?
And totally agree with my colleagues that is very important. It's one world, one science, one people. We need to apply our research of all of the general population around the world. In this way, it's very important to collaborate between different countries with different environment, different cultures, and including the genetic differences of different ethnicities. I think it's our challenge to collaborate between all of us. I was recently I was visit the Shanghai Mental Health Center. It was a nice opportunity for me to visit not just the center, to visit the ways that in Chinese our colleagues are treating and facing the mental health condition. I was asking about the main addictive disorders in China. One of them is tobacco use disorder. It's a very important disorders. And in the majority, it's an orphan disorder because people not recognize tobacco use disorder. But we are having in my country, in Spain, we are having a new research on tobacco use disorder. Probably we can share this research with our Chinese colleagues in Shanghai and compare the results in order to establish that is true, that is just one world, one people, and the same background for all of us.
And now, Professor Potenza, what would you say to policymakers about why mental health must be treated as a fundamental part of public health?
Well, I think it's important for policymakers to take appropriate steps to protect the mental health of constituents, as well as help those who have experienced problems. Some of that will come down to how different jurisdictions approach different potential concerns, and sometimes this can be a challenging endeavor. Taking examples of addictive behaviors in the United States, prohibition of alcohol and gambling did not go well historically, in that people then engaged in illegal activities relating to alcohol and gambling, going back 100 years or so, that then led to the repeal of regulations in these domains. So how do we balance the government's views with respect to individual civil liberties to pursue things that people enjoy doing and that most people can engage in recreationally, with the institutional duties of care of protecting public health? And so this is a main question where different jurisdictions may come down differently. And in the new digital environment, it can be very challenging to understand which prevention efforts are going to work best. Australia, for example, has instituted social media bans on youth 16 and under. There have been many jurisdictions, including in the US, that have limited the use of smartphones in developing youth at school, taking away the smartphones. And there have been some reports that this may help increase attention, increase non-digital ways of socializing, and increase the improve outcomes with respect to education. Now, will this work in all jurisdictions? I'm not sure. And each jurisdiction will need to test this. But I think that the idea that we work together across countries, and this is reflected, for example, in our international sex survey that involved 42 countries, including the US and China and many European countries, where we sought to understand by surveying over 80,000 people from these 42 countries, the extent to which we see similar or different relationships between measures of health and functioning and other factors like impulsivity or experiences of trauma. So by conducting these studies and getting the data in the current environment, we can then communicate information to governments that then can be used to help with respect to policy.
And finally, before we wrap up, what is that one simple science-based thing we can do today to protect our mental health in a high-stress world? Why don't we begin with Dr. Sermon?
Yes, okay. Listen, we are talking about the same because we need to protect our high-risk population. And this way it's very important to that our scientific message reach the policymakers and to do that the things that we are needing in our field. Until now, the only rules or the only things that our policymakers in general in Western countries are moralistic perspective and prohibition as 100 years ago, as Professor Potenza has mentioned before. We need to, or look on the contrary, to liberalize the illegal drugs and without any restriction, without any consideration about the proportion of, for example, in cannabis, the high proportion of THC, that is a psychoactive part of the cannabis. We need to get a balance between all of this to more scientific perspective for the medicine and for psychiatry, of course.
那么赵教授，您会向正在观看我们今天的这个讨论的观众有一些什么样的建议？比如说有一些简单